I want to welcome you all this morning to this session, the Roadmap to Healthy Reopening. This session focused on early childhood. And again, we've said it many times, but thank you to our partners who've made these all possible. Parkview Health, Greater Fort Wayne, Inc., the entire team there has really been helpful in terms of being able to pull these off in a timely way and get through all this information. And members of the Allen County Department of Health. Special thanks to Dr. Deborah McMahon. She's been a great leader since all this was unfolding before our eyes, and here we are now a couple months into it, and everybody continues to do a great job in trying to get this region ready to reopen and move forward quickly. Want to call a special shout out to Parkview Health and Heather Shagler for their expertise that they've lent to this, great experience and expertise and knowledge that has really helped us lead and guide this region and Fort Wayne in a really positive and proactive way. For those of you that have probably been on the session, some of this is going to sound familiar, but we ask you to hold your questions until we get to the Q&A section. And we'll try to get through as many questions as possible. And thank you to many of you who submitted questions in advance. We'll try to address those as we proceed through the session. I want to introduce our, I'm sorry, before I forget, each participant will be receiving a copy of the slides and a link to the recording of the event. And I'm going to announce right here, this is the second series of sessions that we've had on education. And we'll remind you later on to go back and watch that first session as the fundamentals will be presented there as well. So again, thank you for everybody for being with us today. And I want to introduce the participants today from Parkview. Jolyn Suko, the Chief Innovation Officer, Dina Jackway, Chief Community and HR Officer, and Dr. Mike Nip, the Total Health Chief and Medical Officer. And also, I believe Madeline Baker from the Early Childhood Alliance will be joining us today. Really be great to have her in the Q&A session with her expertise in the early childhood sphere. She also is co-chair of the Partnership's Vision 2030 Early Childhood Committee. So we're really pleased to have all of you with us today. And with that, we'll get rolling. And I think, Jolyn, you're up first.
Thanks, John. Hi, as John said, I'm Jolyn Suko. I'm the Chief Innovation Officer for Parkview Health. We're coming to you today from our socially distanced studio in the basement of the Miro Center. And boy, has the world changed in the last 6 weeks. I think in some respects, there's no better time for innovation, but it certainly has happened quickly. So want to share with you a little bit about how we're getting back to business and how we're thinking about the next 12 to 18 months. So first, the virus is here. It's in what's known as community spread, which means it's not limited to one place or area, and it's much harder to pinpoint the source. We don't expect a vaccine for another 12 to 18 months. And we know that there haven't been enough people infected to confer herd immunity. So at Parkview, our goal is to keep the surges of infection in our community low and as many people as safe as possible. Here, our world has changed. Like I said, the studio that I'm coming to you from is completely different. But we've been implementing and evolving safe practices over the last 2 months to help our employees, customers, and community. We're here and we're ready to serve. We began ramping up elective surgeries about 2 weeks ago. It's going very well. We're still very cautious and we're doing it, we're starting those services very gradually, and our visitor restrictions are still in effect. We also really want to get back to business safely, and we want to do everything we can to help you get back to business safely. So in that spirit, we're really thankful for all the community has done for us, and we'd like to return some of that generosity to you. So we have launched Parkview Business Connect, which is a web page and a service where we share what we've learned, We share the best from others. On a webpage, we have specific resources by industry, and it's a living document, and it changes. It's been updated probably multiple times since we've begun because we're operating in a very dynamic environment. We also have a hotline that you can call, and we will connect you to our subject matter experts here within a day to answer your questions. So with that, John, I'm going to turn it back to you. Here's the number for Parkview Business Connect, but I'll turn it back to you to talk a little bit about the governor's Back on Track plan.
I should unmute before I start talking. How about that? If I can go back one, I want to go back one slide. Just remind everybody that everything we're doing to get our region's economy back up and running and with full momentum towards our Vision 2030 goals is being done with the oversight and in conjunction with the governor's plan for Back on Track. And there are 4 guiding principles that the state has laid out for us, and these are very helpful as we move forward. So you can see these before you, and I would encourage you to just search Indiana's Back on Track plan. You can look at these in greater detail. But important to note that these are the things that they're keeping close attention to as we proceed to open the state's economy, to make sure, as you see here, number 1, that the number of hospitalized COVID-19 patients has decreased for 14 days. The state retains its surge capacity. Also, the state retains the ability to test all Hoosiers are COVID-19 symptomatic, and that the health officials have systems in place to contact all individuals. So tracing, these 4 principles are guiding the state's plan. It's really helpful to know that that is the backdrop and kind of the overview by which we're guiding this process. And you'll also know, many of you've heard just recently that we've moved into stage 3. This is now outlined as May 24th through June 13th, but we're a couple of days ahead of schedule here, giving us some confidence that we're making progress. But you can see they've mapped out very carefully what kinds of institutions will be open. For example, restaurants, you see there are opening at 50% capacity. We should be encouraged to see that some senses of normal behavior, we can see those in the community, and we continue to have this plan. So now I'm going to turn this back over to Dina for the workplace and people considerations.
Great, thank you, John. So I want to start by saying thank you. And so many of you have taken care of children during the last 8 weeks, 10 weeks, and you've done it for whether it's healthcare providers, essential workers, individuals who need to be able to go out and continue to do their jobs. And so thank you for doing that. We know that the foundation that you all are building every day, not just in the last couple of months, but being able to give that foundation to children for early education is so important. You're educating our future workforce. You are so key to workforce and economic development in our community. So we want to thank you for that. There are things that run deeper than this moment in time, and no better way to tie that directly to early education efforts that are happening in our community. So thank you for being champions. When we look at workplace and people, it's really important. Some of you have remained open throughout this period of time. Some of you have had to close your doors, and now you're in that restart and recovery phase. And so a few things that we want to be able to point out to you that are going to be really important. First is making sure you identify someone within your organization who's going to be that workplace coordinator. Someone, and it doesn't matter how large or small the organization is. When we think about Parkview, we have an incident command center, and we have dozens of people who make up that incident command center. But for a smaller organization, you might just have one person. But it's who's going to be that central source of truth? Who is going to be keeping up with this ever-changing guidelines and CDC guidelines and Department of Health guidelines and local and national, all of that together, you really want to have someone who's watching all of that very carefully and who can provide the most up-to-date guidance. Because you know that both the parents of the children and also your own team members, they're hearing information from all kinds of sources, some of which are perhaps not the most accurate. And so it is important to make sure that as they're coming back into the workplace or as they're bringing their children within the centers, that it's really important they know exactly how they're going to experience their interactions with you. You want to build flexibility into your plan. And if anything we've learned over the last several months is flexibility. Blessed are the flexible. You absolutely have to have flexibility. Not only are your parents asking for flexibility in the way that perhaps their schedules have changed, so maybe they're not bringing their children as often. And so what does that look like from charging for those services that maybe is a little different than you've done before? And how do you continue to build fluidity into the plan? Because I can guarantee you that in 4 weeks from now, it's going to look different than it looks today. Frankly, it might look different in another week. We don't know that, but it's that constant evolution that we're all going through as businesses and as individuals. And then what are some of those great best practices that you're starting that you might continue in the future? A great example of this that we may have all have experienced is if we're going to a location, maybe in retail or perhaps a store that no longer takes cash. So what are going to be the things in your business that you're going to start being able to work with parents in a new way? Perhaps it's going to be more electronic. Maybe it's going to be more online ways that you're communicating with them, as opposed to some of the paper that are put inside cubicles giving parents updates each day. So there's a lot of great practices that we can take away in what will become that new normal. As you also look at your preparedness plan, a few things we want to remind you of. The first of which is that phased return. For some businesses, and particularly smaller ones, maybe it is you are going to bring everyone back at the same time. For others, you're going to need to phase that over a period of time. And so thinking about, for your individual situations, what does that need to look like? I mean, as a quick example, with Parkview, we have 4,500 of our individuals out of the 13,000 that are working from home. And so we're not going to bring all 4,500 back at the same time. We're going to look at 20% at a time and how they come back, and over probably an 8 to 12 month period, so that we're being very safe and we're protecting everyone. Communication is absolutely paramount, and it sounds really simple and it sounds as though that's very common sense, but I can't underestimate how important this is when you're talking with parents, when you're talking with when they're dropping their children off. They want to make sure it's a safe place now more than ever. And so because of that, that communication needs to always be out there. What are you doing to help protect their children? And what are you doing to protect your coworkers at the same time? Consider different policies and practices and approaches. And I go back to that comment I made earlier about just being flexible, but particularly for the vulnerable. So you may have some of your teachers or some other on your team that can't come back to work right now, or perhaps they need to do something different for a while because they are in a vulnerable population. And so because of that, look at not only the children, but also look at the coworkers within the organization to determine what accommodations can be made so that perhaps everyone can still be taken care of and everyone can still continue to stay employed. It's just really important right now that we step back and look at everyone's needs. And the best way to find that out is simply by asking them. Again, very common sense, but something that we learned a lot as an organization, and what our coworkers needed very early on in this process. The voice of the coworker is really important. The voice of your parents that you're taking care of their children are so important. And so because they're going to make their decisions based on how they're feeling, based on the safety, the safe practices that you're putting into place. And so without communicating that or even asking them what they're expecting, you're going to be making decisions that may not be meeting their needs. So again, just looking and taking a step back and getting the voice of not only the customer and the parents here, but also your coworkers. And then finally, just another great reminder, as you're thinking about how you're bringing your coworkers back that have been ill, or perhaps children who have been ill, or perhaps children who have had parents that have been ill, have a process in place. Have that return to work or that return to services process identified. Have it done ahead of time, making sure that you're communicating ahead of time what those expectations are, that if someone in the family has been sick, how long it is before that child can return, or how long that coworker needs to stay off before they can return. Not only will it help protect those that are already in the centers or in the businesses, but certainly the coworkers, and they're going to respect you more for having that process up front as opposed to reacting to a situation that will make it appear as though perhaps you're not as prepared. Again, preparedness is really important. So we're going to get into some very specific highlights now. We're going to invite Dr. Michael Knipp up, and he is our medical director for the Total Health. I'm going to talk to you about what does that mean for pre-K. Thanks.
Hi there, thanks Dina. Dr. Mike Knipp. So I'm an occupational medicine physician by training, but more than that, I'm blessed to be the dad to 3 amazing kids. So it's an understatement to say I have a vested interest in making education venues optimally healthy and safe. So just a couple slides here to get the ball rolling or continue its rolling for you. There we go. So here is a slide. This is from the CDC. So depending on where you are on your roadmap to your opening your education venue, it's a checklist to see if you are ready. So the lifeguard has said everybody can get back in the pool for the most part, but I think it's worth taking some time to look here and make sure you are ready to do that. As was said before, getting a workplace coordinator for this is a great step because this will be a sustained effort for quite some time. July 4th is our end date at light, but it's not the finish line because we're going to be working with this for quite some time. So these next couple slides here, just as you see May 20, just real recently, the CDC did a very large and very helpful data dump to schools on ways to phase in and things to help you get back to what you want to do. These are gonna be on the links on our site on your specific industry, so I won't land here very long, but I just want to highlight there is a very robust playbook you can use to follow. Broad strokes, of course, there's gonna be nuance depending on your specific situation, resources, and population of your kids and staff. So I wanted to spend just a second here. So the hierarchy controls, we can see that is a classic structure from the industrial hygiene world that I am very familiar with as an OCDOC, as we call ourselves. It basically looks at any hazard or exposure and different approaches to how you can optimize and minimize the risk of exposure to that specific thing. So at Parkview here, we have started calling it more than a mask because we, as you know, masking has been in the news, been everywhere, but there are steps higher up in this hierarchy that are more effective and should be looked at before just going to a mask. I wanted to spend a little bit of time here in this next one, breaking it down a little bit more specifically, but not spending too much time. But for example, up on elimination, if I had to pick out one thing, is having sick staff and students stay home. That eliminates that potential exposure in your workplace. There's other things down on the list. Engineering controls, how do you change the environment of your school? Physically, usually. Administrative controls, this is changing how people use the workplace behaviors. But of course, at some point, as an addition to your overall strategy, PPE or personal protective equipment may need to be used and implemented. Plus, to add to that, I believe the governor in a couple weeks here is going to be providing in the State Department of Health specific guidance that must be followed. So that specific guidance may include any and all of these different tiers of the hierarchy. With that, I'm going to turn it back over to John for some Q&A here.
Yes, thank you very much, Dr. Nip. We are going to move into the Q&A session, and we've got some questions in advance. So we're going to move through these advanced questions and then watch for any additional questions that surface during the session here. So don't hesitate to advance those questions. The first one we want to touch on is how can we communicate appropriately with our staff and families about expectations and precautions that we will be taking.
Great, John, this is Dina. A couple things we want to point out here. First of all, following guidelines from CDC, local health department, the Office of Childcare and Out of School Learning. I mean, there's lots of resources that I think from a hierarchy standpoint that is first and foremost. When we think about providing updates, doing it in a timely manner, as I shared earlier, being proactive is going to be really important versus reacting to situations and then putting out communication as things occur. That's just also giving confidence in the parents that you're on top of it, you're keeping their children and those around them safe. And then also sharing on a variety of channels, using your social media. You might do a mailer, you might mass text out everyone. I mean, at a time like this, use all the channels that you can to be able to communicate. There is no such thing as over communicating right now. And posting signs throughout the building is certainly helpful, perhaps at the entrance and in other places. And one thing that could also be a best practice with Zoom meetings and so many ways that you can connect with parents, perhaps do some virtual trainings or parent meetings and do them in a way that allow parents to interact with you and ask questions similar to what we're doing right now with the webinar. A great way to, again, just connect, although you're not physically in the room together.
Great, thank you, Dina. An important piece of, certainly for the early childhood piece of this, is the participation of parents. So next question, how can we help parents be prepared for changes and possible closures due to illnesses within the school?
Thank you, John. This is Madeline. And I think foremost, I want to say thank you to all childcare providers who are out there. I don't think we can emphasize how greatly we appreciate your involvement in the whole process. So I would say create a communication system that could be used for self-reporting and notification of exposures and closures. I think we cannot underscore the importance of communication. Ensure that parents are aware of how the message will be shared. As Dina mentioned, there are all different processes they could use to make sure that they get the messages. Be as transparent and timely as possible, and share precautions ahead of time so that parents are prepared, and share from the perspective of wanting and desire to minimize the spread of virus.
Thank you, Madeline. Appreciate that very much. Now let's go to the classroom. What does proper cleaning of a classroom and play area look like?
Hi, John. It's Dr. Nip again. So the office, so I'm going to speak for Madeline's organization for a second, just on the medical side. So the good thing is there's a lot of guidance out there on, the when, the where, and the how, so teachers can focus on teaching. And so there's approved FDA cleaners. Obviously, you want to clean before the kids get there. And you want to also consider if you need, I mean, I know from our house, we had 11 billion toys when our kids were pre-K age, but maybe just have a Monday toy box, a Tuesday, Wednesday, and you can keep up with that a little bit more than clean 500 things, because if it's not out, you don't have to clean it, right? So you're going to want to repeat this end of your day. During operations, I wipe down things as needed. The guiding principle is clean hands as much as you can with pre-K kids should touch face. So clean when you want those most optimally to do that. You can't constantly clean. Again, you're there to teach, not be the clean hand police. Bedding and sheets also, you want to keep those laundered. And the big point is at the bottom there, obviously basic that we've all followed as parents and educators. We want to keep those cleaning products out of the reach of kiddos because they may need to be more accessible to the teachers. but still follow that same principle as you don't want little hands to have access to anything they shouldn't. Madeline, do you have anything else to add?
Sure. One thing I want to add is with Dr. Nibb's point about you want the teachers to be in the classroom working with children and teaching them. So if you're strapped for staff to take temp checks or cleaning and whatnot, you can take advantage of Early Learning Indiana's recent offering of Come Back Strong grant. I think they had a webinar yesterday, and you can go to their website, and most child care programs should be eligible. And that way you could use those funds to either reassign, or part-time employees can be given additional hours to those tasks, or you can even temporarily hire someone else to do those kind of things so teachers can be in the classrooms.
Thank you. And just as a reminder as we go to the next question, there is a Q&A tab at the bottom if you'd like to submit any questions online this morning. Next question is, how do we make cleaning and hand hygiene something kids want to do and can participate in?
So this is Madeline, and so we know that children like to be engaged and make fun activity out of things. So with the demand for or mandate for 20-second hand washing is like singing happy birthday, not real fast, but slowly twice, so you can make a game of it. Have children offer reminders to one another. It's so great to have that peer-to-peer reminders of hand washing and covering your coughs and sneezes and your elbows. Encourage parents to practice these kind of, hand washing and at home, so that the children realize that these are normal ways of conducting themselves. And when possible, reward good behavior.
Thank you, Madeline. Next question. How do we open and operate while minimizing the transmission of COVID in our facility?
Okay, so it's Dr. Nibb here again. So some of the slides we've shown, trying to bring signal through the noise, the CDC decision tree, what should you make sure of before you open? The CDC did this interim guidance for childcare a couple of days ago. So the way to minimize, I focus on that word: minimize, optimize, transmission, hierarchy control strategies you could include. And again, I want to put the caveat is we obviously don't know what the state required guidance is going to look like. I'm assuming, these are good ideas no matter who says to do them. So I'm assuming if you get your plan ready to do these things, you're going to hopefully be 90% of the way there. So again, just a couple highlights. Parents who are the experts on their kiddo, symptom check, have kids stay home if they're ill, limit access to the facility. For example, having the classroom staff meet them outside. Stagger the drop off is a good, because you're limiting the amount of people that are congregating in one place. Masking, which we may have a question a little bit later I could speak to. Staff could consider wearing those. Cohorting your kids together, same group of children with staff. This would translate education room to play area outside to lunchroom if you have a separate lunchroom. Hand wash, hand wash, hand wash, hand sanitizer. It's something I highlight is trying to make the optimal healthy choice as easy as you can. So that means have maybe a new hand sanitizer station that is in the middle, not the middle of the room, but very accessible. Visitor, limit the visiting policy. Flexible on payment options, because it's a very tough time emotionally, financially, mentally, et cetera, et cetera. And consider your vulnerable staff members and children. If you have a one-on-one program, Madeline, if you could speak, possibly there could be some resources to add some extra support for one-on-one, because you may need more one-on-one. It could be someone who is designated before COVID needed that, but even now kiddos are going to be having a tougher time, and so you may want to, if you can, bulk up that bench.
I think any resources that you want to obtain, you can go through the office, through the FSSA. You can also reach out to, depending on what county you're in, with child care resource and referrals, either Geminis and upper northern counties or the Child Care Resource Network in majority of the counties in middle northern counties.
Thank you, Madeline. Okay, now this question, I've been wondering this one myself. We've got 2 grandkids, and they're starting to play with their friends in the neighborhood and so forth. But here we go. Children of all ages want to be close to and interact with one another. Do we really need to keep them from playing closely or even hugging each other?
So I'm taking this question, John, and I would like either Dina or Dr. Nip to, join in. But the childcare industry, as an industry, really cannot comply to the, the social distancing. Because after all, we do focus on social and emotional development of children. So children really cannot be asked to not touch one another. But there are some ways that you can minimize some of that, maybe by considering some new models to interaction appropriate for young children, such as you can make a game of it again. You could do the air hugs or elbow hugs. But I think the point here is, and I love this quote, and I personally am going to use this as much as I can, don't miss the good for the perfect. So realize all those situations and comply to that, to those areas that is relative to your program.
And I echo all of that, Madeline. I mean, I think, even during this time, I need the hug from my kids as much as they need it from me. And so I think the don't miss the good for the perfect is the perfect. There is no potential for transmission of germs. Probably. Is it the good? Probably not. So we do the best we can, but we still need to focus social and emotional development and things like that.
Yep, we're going to have to do the best we can. So again, and let me remind everybody, I see now the first question on the Q&A tab. So I just want to remind everybody that this is intended to be interactive. You can enter questions in the Q&A. We will try to get to those. So we're continuing to roll through some of these pre-questions. And the next one we're on now is, how can we safely offer childcare for children who would be considered vulnerable? And lots of information in the news right now, so we're really sensitive to this about how vulnerable our children are to the COVID.
So John, this is Madeline. So caring for vulnerable children requires consideration at all times, not just in these, uncertain times. And we want to make sure that care should be consistent. I think Dina mentioned it in her opening remarks. And offer routines, including making sure that same teacher is working with those children. We want regular communication with parents as much as possible, and ask the questions, are there any new or additional accommodations for children that we need to be aware of? And then also ask them, how are you talking about the pandemic at home? So there's a consistency. Keep in mind that children who are vulnerable need consistency and routine as much as possible.
Thank you. Thank you, Madeline. So our teachers are over 55 years of age. How do they work one-on-one with children safely? Should teachers and kids be socially distant?
So I think as Madeline, this is Dina, as Madeline had shared, it's really hard to say socially distance when you're talking about an interaction with pre-K children. I mean, they're playing, they're being curious, of course they're going to touch each other. I mean, there's a lot of things in that environment as they're learning that socially distancing them would be very challenging. Now, the Governor Holcomb order did mandate to accommodate teachers who are at a high risk. And so as I mentioned earlier, I think it's understanding who are your vulnerable on the teacher and staff side, and being able to perhaps have them do something different, perhaps have them doing some different work that doesn't put them into direct contact with children, or has them doing some things remotely. Madeline and I were just talking yesterday, and there are some things that can someone be doing remote from home, or doing some virtual training with others to be able to accommodate them during this time, so that they're not, they're not interacting with the children, but they're still able to get in the richness of what they want to do and why they chose this field. And so I think it's really important that we look at the teachers and accommodate them as we need, and that might evolve. Going back to that flexibility comment, it might look different in the beginning than 2 weeks or a month later, but that's where that communication comes in between the center leader and their teams.
I just want to add, John, that as Dina said, taking advantage of virtual training opportunity is really prime now, especially those trainings that most programs had to set aside. Now is the time to get at it.
Okay, so the next question here, and again, this has been in the news recently here. What do we need to know about multi-system inflammatory syndrome in children? We know that children aren't at high risk to die from the COVID, but do we need to be concerned about the new development, this new development?
Okay, so it's Dr. Nip. I'm going to try to fit a pediatrician hat on myself. What I also wanted to say, Dr. Tony Giaquinta, who I would call, he couldn't be with us today, so I would encourage everyone to put in questions into the Q&A. We will get those to Dr. Giaquinta and get answers back to you. So this is a syndrome which is really new still a lot being learned. I'm trying to drink from the fire hydrant of info about it. But we can say what Dr. Giaquinta has let us know, the complications don't change course of action that we do. And I think it's trying to reiterate that childcare centers, like we say here, kids who have symptoms should go home and self-monitor. And I would put a point on to say, there are going to be bumps in the road. We will have sick kids, staff, folks in every industry. It doesn't mean what we're doing is not overall working. It's hard to keep that 10,000 foot view when you're on the ground. Obviously, if there's anything that the parent is concerned about, what I would say is let their pediatrician know, get them to care ASAP. Same thing, any educators or staff, they're going to know those kids, know that something is different. It could be increased irritability or something, all of the signs you're used to knowing, and being in constant communication with the parent to say, hey, Susan is looking a little bit different today. We noticed a little bit of a red spot. Is that the rash that's going to be there? So it's early just to say over communicate, like I think Dina said, and just keep those lines of communication open. I did want to comment a little bit there. I wanted to put on vulnerable to try to unpack that word a little bit. So just if you haven't been on our webinars before, we've talked about this. Certain age groups, medical conditions, it's not more likely to get infected. It's just if they do get infected, it can be a more serious course. So thankfully, with kiddos so far, we have not seen the garden variety, if you will, for a kiddo is probably more to the asymptomatic or mild course. But obviously with this new syndrome being noticed, there is potential for a different course for them.
Thank you. Should preschoolers be in masks?
Dr. Nipigan, so I think, again, this is from Dr. Giaquinta, just to parrot him. Kids under 2 should, I don't think juice is worth the squeeze here. I think that mask is going to, if it gets on, be on the ground very quickly. Young kiddos over 2, you could, but I would probably focus, you're better served, kiddos, staff that are ill don't come in, wash hands. I don't think mandating is a good idea at this point. That's kind of where I would stand. Again, I don't know where it's going to come down. If a masking policy or selective masking policy comes down, that's something they'll have to be worked with, and we're definitely here to work with you on how to best implement that.
Great, thank you. Next one can be a challenge. We've heard this in multiple sectors. We cannot find the cleaning and sanitizing supplies we need. Can you help?
I think that Greater Fort Wayne Inc., the COVID-19 Response Center, could be helpful. And you can go onto their link site, greaterfortwayne.com/chamber/COVID-19 Response Center. And then there's also the local mask and sanitizer source spreadsheet. I know the community had, came to the rescue when Parkview put a request out there for face masks. And I think there are a lot of volunteers now who are willing to do that. So also for the PPE marketplace, backontrack.com, gov/PPE marketplace.htm, some of the resources.
Okay, let's try one of the questions that have come over the Q&A tab. One here from Cindy Kugler. Is there any way to be able to utilize our playground when outside? How do we clean the playground?
So Dr. Nipp, again, the one word answer is yes. Because if we think about it too, that outside playground equipment is exposed to the elements constantly anyway, so it's not going to be clean in the ultimate sense. I think if there are the designation a high touch area, if it's a toy that gets a lot of use, probably focus on doing that. Large structures, I'm not sure there's going to be an easy way to do that. Is the return on investment going to be very good? I'm not sure. Again, back to the idea of, we try to control what we can control. Do you get a Monday box again of outside toys, a Tuesday box, a Wednesday, through whatever your schedule is, or even a Monday morning, Monday afternoon, you can cycle through the day, clean those, and just know that it may be time to get that imagination going because they may not have a physical ball, but it's time to make up new games because you may only want to control cleaning 2 or 3 balls or toys or something like that. So I mean, you got to get them outside to run around, get some of that energy burn off. So I think there is definitely a way to still utilize playgrounds.
I think too, John, if I might add, making sure that teachers have sanitizer, lotions or at the front of the door as you're getting the children back into the classroom. So they're already having their hands sanitized before entering into the classrooms.
If I could, Madeline, perfect, thanks for mentioning what I should have. Clean hands go out, clean hands come in.
Really good. That's really good advice. We're going to go to the next prepared question we had in advance. What steps are taken if staff, student, or a family member tests positive? And we should expect these conditions to occur. So this is a great question to get everybody prepared with.
Good morning.
Mindy's on. Okay, good. Mindy, go ahead. Didn't know if you were on.
All right. This is Mindy Waldron. I'm the administrator of the Allen County Health Department. And I think it's first important to understand what isolation and quarantine mean because those will be mentioned. And just briefly, because you hear them bantered about, isolation is where you separate the sick people, someone who has the disease such as COVID, from those who aren't sick. And then quarantine is what separates those who have been exposed to someone who's ill to see if they develop symptoms. So sort of watching them. And so anybody that does test positive for COVID is placed in isolation by the health department, generally at their home, sometimes a little more in a room separated from others in the household. And if they were symptomatic when they get that result, that they're positive, they have to remain in isolation for 10 days until 10 days has passed since the symptoms started, and the person is fever free for 72 hours without utilizing something like Tylenol to bring the fever down, as well as the person does need to show some overall improvement in their symptoms. So there's a bit of a decision that's made to make sure that they are safe to then resume their activities. There are other requirements for if you are a healthcare worker or a first responder, somebody in the essential realm. There are some other things that we can allow when we get to those that are asymptomatic. So if someone was diagnosed, they're going to be in isolation. But as far as the release time frame, if they were asymptomatic and did not have symptoms, they do need to remain in isolation until there's 10 days that have passed since the test was collected. So those are the things that happen to folks that have a positive test. Now the contacts, the people that were close to that case, such as household contacts, sometimes that might also include other contacts they had in the workplace. Those folks have to stay home and complete a 14-day quarantine period where, again, we're watching to see if their symptoms develop. And that period starts on the last day of exposure to that confirmed case. And they also need to remain separated from the person that's ill. So, or if there's no isolation from the positive person, so say they're in the household and maybe it's a parent caring for a child, it unfortunately extends their quarantine period. And that person's, so say the contacts quarantine would start when the positive person's isolation period has ended. So it can sometimes be several weeks. And while that's a confusing thing to talk about verbally, we go through this with anyone who is considered an actual case or a contact, and we give them specifics to their scenario. So there's variations to this. This just gives you a framework with what we work within, and then we work through your specific scenario to what works for you.
Very good. Thank you, Mindy. Now related, if a child's family member tests positive or is under quarantine for possible exposure, should the child be allowed to enter the center?
And similarly, kind of applying the concepts that we just talked about, if we have a family member that tests positive and the child lived there, then no, the child would not be able to attend school or childcare until they themselves are released from quarantine, because they would be considered a contact and a close household contact. So they have to remain home in quarantine and be monitored for their symptoms throughout that family member's isolation period. And then in general, the quarantine and the self-monitoring period is about 2 weeks, unless they continue to have exposure to an adult family member who it kind of comes down to, if you're still being exposed to the person who's experiencing symptoms, or that they are still in isolation as they are awaiting the symptoms to resolve, it just extends the period of time. So the separation is key, as much as we can, keeping those folks apart, even in a home, again, watching for symptoms to make decisions. Is it looking like that person is going to become ill? And so the child care centers and schools need to consider possibly sending things home, learning activities, things to keep them engaged, to the children's home while they're in quarantine, because sometimes they don't develop symptoms, and we want to keep them engaged, obviously.
Very good. And now the last prepared question. We have a few in the Q&A queue, so if you have other questions, be sure to pop them in there. On this last one that we had in advance, this is all related again. If a staff member or student tests positive, do we need to close that classroom, the entire school? And if yes, for how long?
And these are very good questions, because these happen nearly every day. We had several, even into the late evening last night, of this very nature. And every scenario is different. So, as you sit there and listen to the answers and you think of your child care center and you think of, but my classes are this far apart, or the kids don't move, or what if it's an infant and really they never move they don't crawl yet. We consider all of those things as we help you make the decision. And most of the time, it is a decision that we will collaborate with the center themselves and ask a lot of questions, and then we help make that decision. What we have had so far is most times the centers want to make the decision on their own. The only time we ever really have to step in and make the decision is if it's not being done safely. But we certainly consider all intricacies, and we'll help you. So we'll answer your questions. But in general, all of those folks in other classes, or if there's ones that we say, hey, you could remain open, those folks need to continue self-monitoring for symptoms. So anyone that's even had a slight interaction, you're gonna self-monitor. But when we start talking about the high-risk contacts, and now we are looking at people that are within 6 feet for more than 10 minutes and you weren't wearing appropriate PPE, such as masks and so forth, those are considered high-risk contacts. And those folks would not be in the center. They'd be at home doing a 14-day quarantine, again, unless you're an essential worker. And then the entire classroom, or say it's a sports team or a group that might have met within your center or something along that line. If you met the high-risk criteria, you had some close contact to that person who tested positive, then we are going to recommend or require, depending on the circumstance, that that group or team or class be stopped for that quarantine period. We need to interrupt the spread of that disease, and again, watch those folks for the development of symptoms so that they don't become the spreaders. If, however, it's isolated to one classroom or one small event or group, there are times when we could allow the rest of the center to stay in operation with some guidance, with some restrictions, if the exposure was limited. But I can tell you, having done these probably 5 to 10 times a day, I've never had a scenario that's been the same. So we'll work with you and give you advice and determine things, how it works best for you.
Oh, that's great to know, Mindy. And there is a question in the Q&A tab here that's related that Karen Markwell added here just a moment ago. And the question is, what do you recommend for students who develop a fever while at school during the day, which could just be an ear infection or something, but unknown? Do we need to close the classroom or send home all the students for a period?
I'm definitely glad to start the answer, and then I'm sure maybe Dr. Nip might want to hop in as a physician as well. If what we get questions about, whether it's a workplace or say a child care center, if someone does develop a fever, like Dr. Nip has said, it's really most important to look at that sick person first, and let's get them, can we get them to a separate area so they're isolated as you make the next decision? How do you get them home? How do you get them in to be seen by their care provider and make determinations on testing or that type of thing? And then you're welcome to either contact us and we can walk you through some decision making, like what did that child do during the day? Who were they close to? In general, it would be watching for symptoms among the rest of the folks that were with them for that day. It's getting the ill person out of the scenario and then beginning the decisions about the folks that may have been in contact with them. Now, we don't make drastic decisions until we know we have a positive test, because there are other things that can create a fever in a child. Now, if you have an adult that has a fever, that's less normal. So Dr. Nip, do you want to jump in?
Sure, thanks, Mindy. Good advice. I mean, I think the playbook, every center has a playbook, because if a kid has developed a fever, it's usually probably get them some, a different part of the center. It's call the parent to say, hey, Ben isn't acting well, got a little bit of a fever, won't eat lunch. Because again, what Minnie's talking about in medicine is called differential diagnosis, meaning symptom could be how many of 300 things. I mean, I think all parents and teachers have like a medical degree equivalent because, Dr. Mom and Dad and Dr. Teacher are things. But I think it's, until symptoms are tougher than knowing there's been a test that says that the answer is this. I think you already have a procedure for that. It's just to probably revisit that with the staff there. And to, again, let parents know they may be getting more of those middle of the day calls to come get their kid because it's prevent defense times like a million at this point, which makes sense. But I think it's trying to, again, have a designated space where that child can complete their day, eat their lunch, have supervision, because as we know, parents sometimes, based on their job or the situation, they can't get there until 4 p.m. is the earliest they can. So I think it's having that plan in place, but symptoms are tougher. Cough is very, very difficult to deal with because I'm surprised I haven't coughed because I have allergies. Cough is hard to differentiate as well, but knowing if that child has a touch of allergies or asthma, is it a cough that is different? We're looking for difference because there should be, educators are experts on knowing if a child is different than what they're used to. So I think it's focusing on those two things. I did want to highlight too, sorry, Minnie, if you did, on they're coming back in for workplaces, does a cough have to be gone before that person can come back or that child? Usually we say it needs to be improved. And if it were an adult, it would say they would need a mask in the workplace until the cough is gone. Again, it might be more return on investment for a kiddo because we know masking is probably not going to work in the pre-K realm. The cough is expected to just be resolved before they could come back in. I just want to highlight that. Mindy, any difference you're hearing from the state?
No, we would recommend that too. There's a difference in decision making if you are an adult, and especially if you are a healthcare worker or an essential worker. We can allow a little bit different than we can with a child returning. If they're still symptomatic, we would caution against it. So you're exactly right.
So thank you very much. So those questions are great, and we had those in advance. There are a couple of questions in the queue yet, which are really good questions. So I'd like to try to get to those. First, Tammy Piper asked, are there any local recommendations specific to home visiting programs?
I'm happy to start. I'm going to have Mindy or maybe Madeline chime in if there's any organizational or state must-dos. But I would probably approach this the same way we would with our home health care workers, that there is Probably a communication with that home to understand, is anybody sick, doing some basic questions. For that worker that's going into that environment, I would recommend probably mask and gloves and hand hygiene. Obviously if it's going to be a play interaction with the child, you know, if it's not going to work to be in a mask and gloves, you try to be as clean as you can. You know, again, going back to that social and emotional development, trying to do the home visits and those sorts of things. But I think it's trying to take the broad stroke principles and understand, let's not miss the good for the perfect in that home interaction. Do things like that. But again, if there's nuance needed or supplies needed, there's resources out there. So I think home visits should continue. Obviously, if that is a quarantine or isolation home, that needs to be understood.
I 100% agree. That's what we recommend as well. And what we tell people when they ask us what type of PPE or protection that they should utilize, if they are going into a home setting and other masks are not being worn by those participants, is they would likely need to consider wearing an N95 so they're protecting themselves in the environment. Kind of need to look ahead, as Dr. Nip said. Are you going into a situation where someone has experienced symptoms? Then you might want to revisit whether that happens in the way that you normally do it. So I agree with exactly what he said, and just making each decision based on each visit.
Excellent. A couple more questions in the queue here. This one by Tony Hannon. If we are taking temps and evaluating kids as they come in, should we use gloves, masks, goggles, and a smock? And if so, do we have to change PPE between screenings?
Sure, I'll start again. Mindy, chime in if you know something from the state. We are not recommending temperature checks. That's a hard stop. The additional thing is from the literature I reviewed and fed into a position statement that Parkview, it does not really work and will not accomplish what you want it to. It's easier to just make it a easily attainable choice to say, we don't want sick kids to come in, versus again, the PPE outlay, supply outlay, to have a screener do that, to expose that screener to, if it's 50 children plus a parent that's going to bring them, it just doesn't work. This is from studies done on past pandemics in airports where you have upwards of 1 million travelers screened, and they identified maybe 4 people with SARS, which is SARS-1, and SARS-2 is what's causing COVID. So I can't recommend for temperature screening. However, we don't know what is going to come down from the state. There is resource and a way to do that as optimally as possible. But again, as a blanket prepare for policy, I would not recommend temperature checks.
And I have to say, I agree with Dr. Nip in concept, and we hope the guidance changes for certain entities, and I think it will. Sometimes the science and the true knowledge takes a bit to catch up into the regulations. So I know that some of you out there are saying, but hey, the guidance is now saying we should do temp checks. Dr. Nip's right, though. This one is one that's lagging and needing to be explained, that the false sense of security that comes with that, and that it's not an end-all be-all, and it comes with risk as well, needs to catch up. So I know most of the health folks are recommending against that, but if you do it and doing it safely and doing it as best you can with the knowledge that it doesn't give you all the info you may think it does, we hope the guidance will catch up with that.
Okay, and then to follow that up, this is closely related. If a child is sent home sick with fever, how many days do you recommend that they stay home? And they said, they were clarifying, and this is from Cindy Kugler again, our typical policy is 24 hours from last fever without the aid of medicine.
You know what, Dr. Nip, I can answer that for if they're, if they receive a positive test, but I don't want to give blanket medical advice on fever that's not related to COVID. So do you mind stepping in on that one?
No, of course. I'll put that pediatrician hat back on. Again, I think that we address the symptom first. I think in a prevent defense focusing vein, we would want, I don't know if there's a way to say require an opinion from a pediatrician to say the child is okay to come back. I would possibly say it's worth a decent nudge to say, hey, could the pediatrician take a look? It's a fever. This could be teething, it could be whatever, or this could be an early COVID. And I'm not saying every fever is COVID. That's waiting to happen. It's just very difficult based on symptoms to know. If we translate over, Mindy, chime in. I mean, the most protective strategy we have is the 72-hour fever-free. That might be worth looking as policies in place may need to be updated. That might be hopefully a reasonable flex that centers and parents could accommodate. Other thoughts, Mindy?
I would agree with you. And I just didn't want to say that because we speak from absolutes of test results. And for example, why that would be a good way to apply it is if it indeed is COVID and the requirement for release is at least that 72 hours fever-free, sometimes test results can take upwards of a week. And so as you wait on that result, if by chance there is testing, we want to err on the side of caution. And what he just said is what we would recommend as well, if that's the route we go.
Wow, thank you. We covered a lot of ground this morning. I think we got all the questions in the queue, either directly or otherwise. So really appreciate everybody participating. Please utilize this information to help operate open, care for the students and young people that are coming through your doors. Really important that we get this right, and given the importance of early learning and childcare to our employers and employees and residents across this region. Just really appreciate everybody leaning in on this subject and doing our very best to get this right, minimize the spread, and get ourselves back so that we can go to work and enjoy living again. So I want to thank everyone, the presenters who have shown up again and again to do this, Parkview Health, Mindy with the Allen County Department of Health, and thanks to Greater Fort Wayne Inc. and the Regional Partnership for hosting these. And we hope you all have a great Memorial Day weekend. And if for some reason there was a question that you needed answered that we didn't get to today, please go on the Parkview website and post that question and they'll get back to you promptly. Again, thank you everyone for participating today, and we look forward to seeing you in person someday soon. Take care.